I'm Professor Nouchine Hadjikhani. I have an MD and a PhD in neurosciences, and I've been involved in migraine research for more than 20 years. So how much more common is migraine in women? First, I want to stress that migraine is much more than a bad headache. It involves a throbbing pain, usually in one side of the head, but sometimes both, and it's accompanied by a wide range of other symptoms that can include nausea, vomiting, dizziness, together with a heightened sensitivity to light, sounds, or smells. Sometimes it's preceded by neurological symptoms that we call the aura, and that are most often visual, but can have all kinds of manifestations. According to the World Health Organization, migraine affects 1 in 7 adults and is the third most prevalent medical disorder on the planet. It contributes to 50% of the disability burden attributable to all neurological disorders. It's also a costly disease, and in the US alone, it costs about several billions of dollars a year because of missed workdays and impaired work functioning. Women are affected 3 times more than men, especially during their reproductive years. One of the reasons is that changes in hormonal levels that are a contributor to migraine. But migraine is basically a genetic disease that is sensitive to the environment and can be triggered by all kinds of things, from too little to too much sleep, or certain types of food, or just even skipping meals. The biggest challenge in diagnosing migraine in women may be the lack of knowledge about the condition, both in the general public and for some primary care physicians. There are no biomarkers for migraine, no easy blood test or other to determine whether a person suffers from migraine or something else. People need to be sensitized and made aware of what migraine is. It is important to make the difference between migraine and tension headache, as the pathophysiology and the treatment are different. Also, physicians have to admit that it is a complicated condition and that it takes time to both evaluate and to treat. We need more headache specialists, and it is rare to find the right solution right away to prevent migraine to occur. What should change about migraine care for women from diagnosis to treatment, in your opinion? The first priority should be to not let things get worse. Episodic migraine, if left untreated, can transform into chronic migraine, which is defined as more than 15 days with headache every month, and that is very difficult to treat. Migraine is due to a cascade of events that lead to neuroinflammation, that's inflammation of the brain, and the more often it happens, the more sensitized the brain will be, and one gets into a vicious cycle. Migraineurs know that sometimes after an attack, just touching the face or the hair can hurt. This is called allodynia, and it is one of the manifestations of the brain being sensitized to pain. So it is important to nip things in the bud as often as it's possible, and people should not feel like it's a good idea to play it tough and ignore when they have a migraine, because it may come back a little worse each time. This is the biggest misconception or stigma about women and migraine in the medical community. Finding and receiving proper care for migraine is a huge public health problem. Maybe it is because migraine attacks are often connected to the menstrual cycle, hence brushed away by some as being just something normal. It's remarkable to see that many diseases that are more prevalent or exclusive to women tend to have had that fate. Think, for example, about endometriosis or fibromyalgia, that doctors for a long time have not been taking seriously, calling them functional disorders, until scientific evidence showed that this is something very real. Treating migraineurs takes time and patience. One needs to understand what provokes the attacks, to create diaries, try preventative treatment alone or in combination, and time spent with patients is often not a thing that insurance companies give good support for. Migraine is not an excuse that women come up with to avoid this or that. It's an actual neurological condition that needs to be taken seriously, as it has long-term effects on the brain. How can fellow healthcare professionals increase education and understanding of migraine in women in the medical community to improve the care and treatment of women with migraine? How can healthcare professionals improve awareness, both publicly and in the medical community, on the disproportionate amount of women with migraine and the impact this has on their professional and personal lives? So having campaigns such as this one is extremely important to raise awareness, both for professionals and for patients. We need more headache specialists. We need to get more funding to research what may be specific to female in animal models and have a better understanding of the role of female hormones in migraine. Then, websites that explain what migraine is and destigmatize it are important. Clinicians must also learn that things are more complicated than is often taught in medical school or in textbooks. The aura is often perceived as scintillating scotoma that are growing in half of the visual field and experienced before the headache starts. But the symptoms depend on where the cortical spreading depression, which is the chemical phenomenon that starts the cascade of events that end up in the migraine headache, takes place. If it is in the visual cortex, then you have visual manifestations. But it can happen in different parts of the brain, and then the symptoms are much more subtle sometimes. Difficulties finding words, naming things, transient weakness, pins and needles going up one arm, etc. People need to be aware that avoiding certain foods can be useful and that proper sleep, meditation, breathing exercise, and other stress-reducing techniques can be of help to reduce migraine frequency. But most importantly, women need to be made aware that this is a serious condition, that it has long-term impact on the brain and on its functions, and that it needs to be respected and treated seriously. They should not hesitate to consult and ask for help. One important aspect regards also all that is associated with pregnancy and lactation, as some preventative medicines can be dangerous for the fetus. So awareness in that domain is very important as well. Finally, measures to improve quality of life need to be taken and include the fact that employers need to understand that migraine is a valid reason to miss work.